Asthma and chronic obstructive pulmonary disease, COPD, are both chronic respiratory conditions, but they affect the lungs in different ways and have distinct characteristics. Asthma symptoms typically include wheezing, shortness of breath, chest tightness, and coughing, often triggered by allergens or exercise, whereas COPD symptoms, which usually develop due to long-term exposure to irritants, include a persistent cough with mucus, shortness of breath, and frequent respiratory infections. While asthma can generally be well managed with the use of inhaled corticosteroids and bronchodilators that help ease symptoms during flare-ups, COPD treatment may involve bronchodilators, steroids, and lifestyle changes, and in severe cases, oxygen therapy or surgery. Asthma is often associated with a family history and environmental triggers, while COPD risk factors include smoking, long-term exposure to air pollutants, and a history of frequent lung infections. Understanding these diseases is critical as they can severely impact quality of life, but can be managed effectively with proper treatment and care. Here's a look into the detailed aspects of asthma versus COPD symptoms, their management, and how they diverge in pathology and patient experience. Onset age, early life versus late adulthood. Asthma typically presents earlier in life, often during childhood, whereas chronic obstructive pulmonary disease, COPD, generally manifests later, usually in adults over 40 who have a history of smoking. Asthma attacks can be triggered by allergens, cold air, or exercise, with symptoms presenting as wheezing, chest tightness, and difficulty breathing. These symptoms often vary in intensity over time. COPD, on the other hand, develops gradually and is characterized by a persistent cough with mucus, shortness of breath, and frequent respiratory infections. The airflow limitation in COPD is progressive and not fully reversible, unlike the typically reversible airway obstruction found in asthma. Disease progression, variable course versus steady decline. Asthma is characterized by episodic flare-ups where symptoms like wheezing, shortness of breath, chest tightness, and coughing can intensify rapidly, but also subside with appropriate management or even spontaneously. The progression isn't necessarily linear, and patients can have long periods of relatively normal lung function between exacerbations. By contrast, COPD, encompassing chronic bronchitis and emphysema, typically presents a more insidious onset with a steady decline in lung function over time. While COPD can have exacerbations, the overarching trajectory is one of gradual deterioration rather than the peaks and valleys seen in asthma. Identifying these patterns is crucial for clinicians to provide accurate diagnoses and tailor management strategies effectively. Primary symptoms: reversible airway obstruction versus persistent airway obstruction. In the differential diagnosis between asthma and COPD, chronic obstructive pulmonary disease, primary symptoms play a crucial role. Asthma is characterized by reversible airway obstruction, often presenting with episodic wheezing, coughing, and shortness of breath that can be significantly relieved with appropriate medication, such as bronchodilators. This reversibility is a hallmark of asthma and is often confirmed with spirometry tests showing improved lung function post-bronchodilator use. On the other hand, COPD is typically associated with persistent airway obstruction due to long-term damage to the lungs, most frequently from smoking. COPD's symptoms, such as a chronic productive cough, frequent respiratory infections, and shortness of breath, are progressive and less responsive to bronchodilators. Exacerbations may occur, but the baseline level of lung function, which often steadily declines over time, does not return to normal as it can with asthma. Understanding the nature of airway obstruction in these conditions is vital for tailoring effective treatment strategies and optimizing patient outcomes. Trigger factors: allergens and exercise versus tobacco smoke and environmental factors. Asthma and COPD, chronic obstructive pulmonary disease, share symptoms like wheezing, coughing, and shortness of breath, leading to diagnostic confusion. Asthma often manifests following exposure to allergens or physical exertion. Patients may notice a clear pattern of flare-ups tied to specific triggers, such as pollen, pet dander, or exercise. In contrast, COPD symptoms typically worsen over time and are most strongly associated with long-term exposure to harmful substances, particularly tobacco smoke and occupational dusts or chemicals. While asthma attacks can be somewhat predictable with known triggers, COPD progression is more insidious and can be accelerated by continuous exposure to environmental factors, with symptoms gradually worsening over time. Response to therapy: good response to bronchodilators versus limited response to bronchodilators. Asthma and chronic obstructive pulmonary disease, COPD, are both obstructive lung disorders that can present with similar symptoms such as wheezing, coughing, and shortness of breath. However, in the context of their response to therapy, particularly bronchodilators, there is a significant difference. Asthma patients typically have a good response to bronchodilators, which are medicines that relax the muscles around the airways. When administered, these medications can swiftly alleviate symptoms and improve lung function. In contrast, patients with COPD may have a much more limited response to bronchodilators. While bronchodilators can still be part of COPD management, the obstructive pathology in COPD, primarily due to alveolar destruction and chronic inflammation, does not reverse as readily and therefore does not provide the same level of symptomatic relief as seen in asthma. This distinction is critical as it helps guide effective treatment plans and manage patient expectations regarding the relief they may experience from their symptoms.